Hello, this is Dr. Sandra Cabot. I have created a series of videos on how to help gallbladder problems. And if you have a gallbladder problem, or if you have lost your gallbladder and are still having problems, then these videos will be of great assistance to you. I have been a medical doctor for nearly 50 years, and I graduated with honours in medicine and surgery from the University of Adelaide, South Australia, in 1975. I have always believed in a holistic approach to health issues, utilising modern medicine and natural therapies. This approach gets the best results and is the safest strategy. Gallbladder problems are common, and sufferers need more holistic information for a long-lasting beneficial approach. They need guidance to help them make decisions, especially if they should try to keep their gallbladder. Gallbladder problems can be serious and life-threatening, so you always need to seek an expert medical opinion. If you must have your gallbladder removed surgically, cholecystectomy, do not feel negative about it. Sometimes having your gallbladder removed can be life-saving. It can just be bad luck that a pesky gallstone of a certain size got stuck in your bile duct and caused pain, infection or jaundice. It then becomes a mechanical problem which needs a surgeon who can remove the stones or remove the gallbladder. After you have lost your gallbladder, there are several vital and easy things you can do to stay just as healthy or even healthier than you were before losing your gallbladder. You will learn about all these things in this series of gallbladder videos. Let's start by explaining what the gallbladder does. The gallbladder is a sac that stores and concentrates bile. The gallbladder concentrates bile approximately 5 times, so it is much stronger and effective for digesting and absorbing dietary fat from the intestines. The gallbladder does not make bile. Bile is made by the liver. The liver secretes the bile into the bile ducts, which are pipes made of connective tissue. The bile flows through the middle of the bile ducts to the gallbladder and eventually to the small intestine. What happens to the gallbladder when you eat? When you eat, a hormone called cholecystectomy is released from your small intestine, which makes your gallbladder contract. When the gallbladder contracts, it ejects concentrated bile into the small intestine where it mixes with digestive enzymes. Digestive enzymes are made by the pancreas. Let's talk about bile. Talking about bile may not seem that exciting, but it's amazing how important bile is to good health and the large variety of things that bile performs. Healthy and plentiful bile is vital for the health of your whole body. Bile is a yellow-green coloured liquid that is manufactured by the liver cells. The adult liver produces approximately 500 mils, half a litre, of bile each day. That's a lot of bile. The liver cells secrete the bile into tiny bile ducts called canaliculi. The tiny bile ducts join up into larger and larger bile ducts like the branches of a tree and eventually go into large ducts called hepatic ducts, which take the bile to the common bile duct and the gallbladder to be stored. Bile consists of around 90% water, in which are dissolved bile salts, bilirubin, phospholipid, cholesterol, amino acids, steroid hormones, enzymes, porphyrins, vitamins, broken down toxins, and heavy metals. Bile has a lot of ingredients. Bile also contains drugs and environmental toxins that your liver has broken down and secreted into the bile. What does bile do? Bile detoxifies you. Bile is the major excretory route for heavy metals, including lead, mercury, arsenic and cadmium, that must be removed from your body. Bile is the major route for elimination of excess cholesterol from your body. Many hormones are excreted in bile and eliminated in the bowel actions. Bile helps your immune system. Bile protects your gut from infections by excreting immune substances and stimulating the immune system in the intestine. Bile has antiseptic properties to keep your intestines clean and your gut bacteria in balance. Bile helps your intestine to function better. Lack of bile can cause lots of digestive and bowel problems. Bile lubricates the intestines, thus reducing constipation. Lack of bile causes an imbalance in gut bacteria and undesirable small intestinal bacterial overgrowth. This can lead to bloating, gas, poor nutrient absorption and reflux. Bile is alkaline and neutralizes stomach acid, thus regulating the pH in the small intestine. Lack of bile can cause excess acidity, resulting in acid reflux, indigestion, and increased risk of ulcers. Bile is recycled from the gut to the liver. Bile is so important that your body does not want to waste it. The bile used for digestion is reabsorbed from the small intestines and travels back to the liver via blood vessels known as the portal veins. Once returned to the liver, the bile is reused. This process is called the enterohepatic circulation. Indeed, 95% of bile acids are reabsorbed in the small intestines and returned to the liver. The reabsorbed bile helps to cleanse the liver. Bile is liver cleansing. Bile works like a detergent. In the intestines, bile contains bile acids that break down dietary fat into much smaller particles so they can be digested and absorbed from the small intestine. Bile acids in the bile need to be plentiful as they reduce the formation of cholesterol gallstones. You need a healthy liver to make correctly balanced bile. Bile is needed for the absorption of fat-soluble vitamins. Without adequate bile, you cannot absorb fat, and thus cannot absorb fat-soluble vitamins. These include vitamins A, D, E, and K. You can become deficient in these vitamins if you do not have enough bile. Fat-soluble vitamins are critical for health and anti-aging. Vitamin A keeps your skin, mucous membranes, and eyes healthy. Vitamin E is an antioxidant essential for heart and blood vessel health. Vitamin D is essential for immune and bone health. Vitamin K is essential for bone health, blood vessel health, and blood clotting. Lack of bile can affect your mood. Bile absorbs essential fatty acids from food. Essential fatty acids are required for your brain to function normally. Cholesterol and essential fatty acids form a large part of the structure of a healthy brain. A lack of bile can lead to a deficiency of the good cholesterol and essential fatty acids that are required for a healthy brain. This may result in poor memory and mood disorders. You may be impressed by all the things that bile does in your body. I certainly am. The gallbladder is underappreciated. It is not good for your health to have a lack of bile. In this series of gallbladder videos, you will learn what you can do to overcome this problem. We will also discuss gallbladder surgery and how to care for yourself if you must have your gallbladder removed. Many people suffer with a lack of bile, but it is not always recognised or treated correctly. Indeed, the gallbladder is often considered an unnecessary organ. You can be healthy without your gallbladder, but you cannot be healthy without bile. In these videos you will learn how your liver can make healthy bile and how you can have enough bile without a gallbladder. For more information, see further series of our gallbladder videos and our book titled Gallbladder Problems, and visit liverdoctor.com. If you like this video, you can hit the subscribe button. Thanks for listening. I look forward to joining you again for another video on how to help gallbladder problems.